Good day, ladies and gentlemen. I must thank you again for allowing us into a home for another episode of your program, Let's Talk About Infertility Openly. Just as a form of reminder, in vitro fertilization is perhaps the most effective medical intervention that helps couples with challenges with conception. And what do? We collect sperms from the man, eggs from the woman. We put it together. We keep it in a special place. And after about 3 to 5 days, we put it back into the womb. And many times, God on our side, we have a pregnancy. But it's not all the time that it's smooth like that. At times, like every other thing, we have surprises. And these surprises are complications. So I was hoping today we can talk about the complications of in vitro fertilization. One of the commonest complications we have in vitro fertilization is the fact that the in vitro fertilization treatment may fail, what we call a failed IVF treatment. This is an extremely traumatic experience, considering how much money has gone into it, considering how much effort has gone into it, but then a failed treatment can happen. And when it happens, important things, being able to identify it and know exactly what caused the failure, so that we can take a decision on how best to correct that. A very common complication we have also is something we call ovarian hyperstimulation syndrome, in which case the woman responds excessively to the medication that she was given. And this associated with abdominal pain, swelling, vomiting, is risk of ill health. It's a potentially fatal complication. The fortunate thing is that we can predict people that will have ovarian hyperstimulation syndrome. And when we predict them, we can take proper steps and prevent these complications from happening. Ovarian hyperstimulation syndrome, otherwise called OHSS. I know that in this part of the world, having twins is greeted with joy. Having triplets, even with greater joy. But we think that multiple gestations, twins, triplets, quadruplets, quintuplets, they are actually complications of in vitro fertilization. This is because the more the number of babies there, the higher the risk that the woman will have a miscarriage. The higher the risk of bleeding before pregnancy. The higher the risk of losing one of the babies. The higher the risk of bleeding after delivery. All the complications of pregnancy are more the number of babies you have in the womb. I will not do justice to this topic without talking about two complications that people talk about a lot. Number one is abnormalities in the baby. Abnormalities in the baby. Truth of the matter is that even with natural conception, we can have abnormalities in the baby. And so out of 1,000 women that have natural conception, if 2 of them have abnormal babies, in vitro fertilization, out of 1,000, maybe 3 or 4. So yes, it's increased, but it's just marginally increased. It's not something that is likely to happen. We should have that in mind. And I hear people ask me all the time too, in vitro fertilization, does it increase the risk of cancers? Does it increase the risk of cancers? The answer is no. What we know is that the fact that a woman has not gotten pregnant by the age of 35, 37, that fact increases her risk of having ovarian cancer or breast cancer. So if someone like that comes out with cancer, it's not from the in vitro fertilization she had. It was a risk she had even before the fertilization. The good thing is that the drugs we use for this in vitro fertilization are used for a short time, and the effects are reversible. I want to remind you that the drugs that we use are drugs that are produced normally by the body. Something like follicle stimulating hormone, something like estrogen, something like progesterone. They're drugs that are produced normally by the body, and so because of that, the body is very familiar with them and has a way of excreting them as time goes by. I really do hope you've learned something from our discussion today. Till we see again, have a fantastic day.